Welcome, everybody. It's the Radiosurgery Show with Dr. Gil Lederman, MD, New York's only Harvard-trained, triple-board certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving into special cases, and, of course, answering your questions. I'm Rob Redstone, broadcasting from the WABC studios in the heart of New York City. And now, please welcome Dr. Lederman.
Good morning. Good morning, everybody. How are you?
Good morning, Dr. Lederman.
I'm here with John Taransky, my co-host. We have a special guest today, Ariel Lederman, co-host and star of his life. Welcome, Ariel.
Good morning, Dr. Gil.
How are you today?
Great. How are you?
Hey, okay. And we have in the booth Coop running the show and Aaron taking your calls. And we're really live in New York.
We are here.
Are we here?
Right, I'm here. It's Saturday morning.
We're live. We're really live. We want to hear your questions. We can't answer them all unless you call us. So our number here is 800-848-9222. 800-848-9222. Toodaloo. So we're here, and there's a lot of interesting cancer news today. We have a lot of interesting cases today, and usually we never have enough time, so I apologize in advance for not having enough time. But let's talk about what's new. There's a new article in the Wall Street Journal, actually it was published in a medical journal, that looked at mutations that were tied to multiple cancers. So, Ariel, what's the idea of looking at mutations?
Sometimes some people have one mutation that can cause 10 different types of cancer.
Right, or they can have 10 cancers all caused by one mutation. So the idea...
And some mutations run more in families than others.
Right. So the Cancer Genome Atlas looked at genetic mutations that were common in 12 different types of cancer. So doctors like you are trying to find the key to cancer treatment, and hopefully one day you can just take a pill
and stop cancer.
That would
be
never
happening.
That would be the dream.
That would be one great day when we can all sit on the beach. You don't have to fear cancer. You just take pill number 62. If you have defect number 54, you take pill number 62. The cancer goes away, and you're home free. Right? That's
on the beach.
idea.
Yes.
In a perfect world.
That's the idea.
Yep.
So what was the study? It was published in the journal Nature, which is a very prestigious journal, and they're trying to study all genetic abnormalities in cancer patients, and they've already found many. Researchers analyzed genes from 3,200 cancers of the breast, uterus, lung, colon, brain, kidney, and other sites. And the idea was to find common reference gene that could be used for diagnosing and treating these cancers. So can we treat cancers in a better way? And the answer is it's tuning in that way. We often give genetic treatment or biologic treatment for people with cancer and often see great results. We had a woman this week who came to us from Virginia. She's on biologic medication, and she has a cancer in the lung, lymph node, brain. We gave radiosurgery to a large mass in the brain. The others are being treated right now with genetic treatment, and she's doing pretty well.
Have you seen any patients this week with some family genetic mutation?
Well, we don't know of all the genetic mutations because the tests don't all exist. Now, in this report, there were 127 genes that had a high likelihood of being drivers of disease. And again, for example, one gene is called BRAF, and it talks about the highlights and the challenge of finding these mutations. So there is a treatment already. A company called Roche has a treatment for melanoma patients with this defect. And in small studies, it showed some promise in the lung cancer patients with the same mutation. But the drug used alone has little or no effect when this genetic mutation occurs in colon cancer. So there's lots of interest and a lot of studies going on. You wanted to talk about NF2. Ariel, tell me about NF2.
It's a type of genetic mutation that predisposes people to certain types of cancers, most commonly acoustic neuromas.
Well, those are not cancers; they're tumors.
It's a benign growth.
Tumors in
both.
So there's kind of tumors. There's benign and malignant.
Yes.
So NF2 have
benign
tumors, but they have terrible tumors throughout the brain and nervous system.
Yes.
And yes, we saw a young man who's a lawyer. He's an attorney, U.S. attorney. and he had surgery on one side and
radiosurgery on the other.
Right. So he had surgery and was left deaf at the age of 27.
Wow.
He's a U.S. attorney. He needs his hearing to work. He has a 3-year-old baby. So he got on the phone, and we were on the phone together with him, and he was so grateful that he had radiosurgery because radiosurgery allowed him to hear, to function, and carry on his career.
And that's something that you wouldn't be able to find anywhere else.
Well, if he had surgery on both ears, he would have been deaf.
Sure.
So we actually have the largest experience in the world treating acoustic neuromas. Correct?
How many have you treated?
More than 1,000.
Wow.
And every patient has had the same dose. And the beautiful thing is when you have the same dose, you can analyze and report. And we've reported our data at medical meetings around the world. I know you were reporting data in China this spring, correct?
Yes, on prostate cancer.
And prostate cancer. And I think you also reported on kidney cancer.
We did kidney in
pancreas.
Amsterdam.
Right. So you've gone around the world already to report. We have Peter on the line who wants to talk about kidney cancer. Peter, good morning from Lincoln Park, New Jersey.
Good morning.
How are you today?
Thank you. Good. Thank you for taking my call.
So what's your question today?
I have stage 3 kidney failure due to 25 years of taking lithium.
Well, I'm sorry to hear that. Is it a cancer you have or a kidney failure?
I had failure. I'm bipolar disorder, and I took lithium for 25 years.
Okay.
And I had a biopsy done, and it was negative.
Okay, well, that's great.
That is great.
I'm happy to talk about kidney cancer. We actually have one of the largest experiences in America treating kidney cancers with radiosurgery. So kidney cancer was historically thought to be a radio-resistant cancer, and actually we know now that it's very, very sensitive to radiosurgery. When we treat kidney cancer, and Ariel, you've reported this in Amsterdam at the focused treatment meetings this spring. Our success rate in treating kidney cancer, where we attack
where you aim the beam,
is what? What's the data?
I was about 88% about.
Yeah, approximately 90% of patients that we treat, and that can be kidney cancer in the kidney,
or outside
in the lymph
the
node, in the bone, in the lung, or elsewhere. So we actually have a very successful program. And we've also given lectures at the National Kidney Cancer Foundation and have patients around the world. We have a man that I just saw yesterday in the clinic who had kidney cancer in 5 spots. And he's been at all the big hospitals in New York, and you know what those are. Mm-hmm. And he came to us. We've treated those 5 spots over the last year, and he's in complete remission.
Wow. And this was not the case beforehand, I would assume.
He had active growing cancer. He came to us. He's now in complete remission. He came running to our office at 5:30 yesterday afternoon, wanting a copy of that report showing that he's in complete remission.
Wow.
He's fully functional, working full time. His wife actually has called the program to talk about the success, because this is not the first time. This is actually a follow-up scan that shows it for the second time that he's in remission. So it's really incredible results. So thank you, Peter. We wish you well. And if you have other questions, please feel free to call me. You can call during the week at our number, which is direct to our office, 212-CHOICES. 212-CHOICES is our office number. There's other news besides this genetic abnormalities and work on finding a common link to cancer. In the Wall Street Journal, this company that makes robotic surgery devices, Intuit, is actually going down the tubes. And I think
Puppet surgery, is that right, Doc?
Puppet surgery.
Puppet surgery.
Yeah, Ariel was actually at the National Cancer
I saw a big
meetings.
smile on Ariel's face when I said that, so I assume.
Well, why is it called puppet surgery? Ariel, why is it called puppet surgery?
Well, you have the surgeon there who's standing behind this machine, and the machine's operating, and the surgeon's controlling the machine, a puppet.
Right.
Yeah.
So the doctor.
Someone is controlling the machine.
So the doctor has his hand in like a glove.
Right.
And
I think his feet too.
And wherever the doctor's hand moves in the glove, the machine moves. So the doctor loses that touch between the patient and his hands,
which is very important.
Which is very important. And actually, if you look at complication rates with robotic surgery, complication rates seem to be higher for men who have prostate cancer. For example, there were 220 men who had open surgery and 406 who had robotic surgery, studied at Harvard. And for sexual function,